Good day, and welcome to our Code Blue series. January is Human Trafficking Awareness Month, and in conjunction with our partners in the Human Trafficking Task Force, more specifically the Prince George's County Human Trafficking Task Force, we are going to release 5 different video conversations around the issue of human trafficking. The task force is comprised of many partners, both public and private sectors. And so the 5 videos will touch on different aspects of human trafficking. Today, we are thrilled to have in conversation with us the University of Maryland SAFE Center and Heart to Hand. And so before we continue on with our discussion, let's welcome, please, our panelists. So let's start with Heart to Hand. If you would introduce yourself personally, tell us what you do, and a brief overview of what Heart to Hand does.
Good morning. My name is Kaniya Walker. I'm the lead linkage to care navigator at Heart to Hand. So Heart to Hand is a 501c3 community-based public health organization. We provide services for those living with HIV and other sexually transmitted infections. We also have, at Heart to Hand, we're like a one-stop shop in Prince George's County. We have a pharmacy, we have a full clinic, we have different psychosocial support groups, such as we have a men's group, we have a women's group, we have a transitional group for those who are HIV positive, transitioning from youth to adults. And also we have a trans support group, which I'm the facilitator of that group.
Outstanding, outstanding. And if, please, we would have University of Maryland SAFE Center introduce themselves.
Yes, good morning. My name is Jatnaa Gomez, and I am the Equity and Community Engagement Advisor for the University of Maryland SAFE Center. So the SAFE Center is the only comprehensive service provider in Prince George's County for survivors of human trafficking. And we provide a wide range of services, ranging from legal services, economic empowerment, social services, mental health services. Our goal is to provide an comprehensive range of services where we make sure to cater to the whole individual and ensure that survivors are able to go to one place to receive all of their services.
Outstanding. Thank you so much. So back to Kaniya, if you could tell us, how long has Heart to Hand been in the county?
Heart to Hand has actually been in the county for 20 years. We just, I've been with Heart to Hand for, it'll be 2 years in January. So my first year starting there, they were just celebrating their 20th anniversary. So they've been in Prince George's County for 20 years.
That is wonderful. Do you know the history or why or how it started?
It started from Deidre Spears and her best friend. I can't remember her name, but she's deceased. They started it for Black women who were living with HIV. Neither one of them were living with HIV, but there was something they felt were needed in the community. And from the history, Deidre always says that they started the organization in her apartment with a $150 check. And from that point, now we have a full clinic, we have a pharmacy, so it has grew over the 20 years.
That is wonderful. Can you tell us a little bit about very particularly what you do? Explain what this Navigator does.
Everything.
Okay.
It seems like everything now that we're working from home, but normally if I'm in the office, I'm a part of the Linkage to Care team. I'm the lead Linkage to Care navigator. So we have a lot of partnerships. Like we have the partnership with the University of Maryland SAFE Center now, but we have other partnerships with like different nursing homes, rehab centers. We do a lot of health fairs. So we go out and we provide HIV testing to people in different locations in Prince George's County. We always aim, like we'll look up the zip codes, and we always aim to try to go to where the numbers are higher at. And I also run the trans support group at Heart to Hand, and just a little bit of everything, anything that they need. Right now we are doing social media live, so I'm kind of in charge of that as well. So, yeah.
That sounds amazing. So Jatnaa, tell us the history of the University of Maryland SAFE Center, what SAFE stands for, and how this whole idea came about.
Sure. So the center was started much like Kaniya mentioned, very similarly to that. It started by our executive director, Susan Esserman. She has a very accomplished career as an attorney, but in her practice, she started to see a trend of a lot of survivors of human trafficking. And in seeing for legal services, she also started to see the need. She started to see that coming from Prince George's County, and that in needing legal services, there were a lot of gaps in other services that they needed. And they were having to go to so many different places outside of the county to get those needs met, which in turn provided a lot of barriers for them. So she began to look for different connections, different resources, and then the partnership started with the University of Maryland, where we were able to connect that piece of advocacy research to make sure that we were not only providing the highest quality of services for the clients, but at the same time, we're making a difference in the legislations and ensuring that our clients were receiving the best care possible.
Outstanding. So tell me a little bit about what you're seeing, the types of survivors that you're serving at the University of Maryland SAFE Center.
Yeah, so 45% of our survivors are coming from Prince George's County, 45 of our survivors from Maryland. We serve Maryland. We see some from the District of Columbia and a few from Virginia, but mostly from Maryland. And 45% come from Prince George's County. And the highest percentage of those reside in College Park, Suitland, and Hyattsville. And they come from all over the world. So we have some from the United States, Mexico, and Philippines. We see everything from sex trafficking, labor trafficking. We see a combination of sex and labor trafficking. And we have seen the very rare organ trafficking case just once.
That's fascinating. So to provide a backdrop for those who may not really know anything about human trafficking. So just as Jatnaa has said, human trafficking comes in two forms, both labor and sex. And as she has said, the University of Maryland SAFE Center sometimes sees a combination of both, with one individual being trafficked in both areas. And just as building blocks, human trafficking means the force, fraud, or coercion of someone to either perform a sexual act in exchange for something of value, or forced labor in exchange for value. And there are many dimensions and layers within each of those types of trafficking, so that as you're listening to this conversation, you have sort of a backdrop. The organ donation that Jatnaa was referring to is something. So can you expound upon that a little bit, sort of add to the building blocks that we have now told our listeners?
Sure. So in terms of the organ donation, that's one of the, and it's not a donation. It's more, it's theft is one of the most gruesome forms of trafficking that we have ever seen. That was the rare case of, there is a lot of violence involved. I was not involved actively in that case, but we've seen it once, and it was of an international client that was coerced, and as you mentioned, there was fraud and coercion involved in there, where they were lured and believed that they were coming for a legitimate work opportunity, where they were looking for a better life for their family, and ended up in a situation where they were actually coming in for ended up thinking that they were getting a medical procedure, where actually it was something completely different, where their organ was actually stolen from them. And it's one of those cases where there's so many layers to it, right? Because you have to involve so many different providers, different authorities. And it's one of those where it's difficult to describe the level of coercion that that person experiences, the level of abuse that that person goes through, and the level of trauma that is involved in that type of case.
Yes, it sounds absolutely like the worst possible nightmare, to be separated from, first of all, an environment or things that are familiar if you are in another country, and then to have this horrible violation occur. So I'm glad that the University of Maryland SAFE Center was there to help with the wraparound services. And we'll get back to that in just a minute, but I did want to ask Kaniya about Heart to Hand, and really, again, sort of if you can tell us a little bit more about, what sorts of survivors or clients are you seeing and serving, and sort of how it all works.
Well, as I stated, Heart to Hand started off with servicing Black women in Prince George's County. So, throughout time, Prince George's County is the number one, is number one with new diagnosis for HIV out of the state of Maryland. So with that, they began to expand onto like men, the LGBT community, and the trans community.
So we've talked around it, but now let's talk about the intersection between how does Heart to Hand and the University of Maryland work together, and this fairly new partnership that we are thrilled and excited about in the county?
Sure. So in our quest to ensure that our clients are receiving the wide range of services, we recognize that reproductive health is one of those services that we have to ensure that our clients are educated, that our clients are receiving that compassionate, high quality, services that Kaniya mentioned, and that our LGBTQ plus clients are feeling supported, as she mentioned as well. And so Heart to Hand, in being part of the Prince George's County Human Trafficking Task Force, seemed like, and with their history in Prince George's County, knowing the community, serving the African American community, serving the LGBTQ plus community, was just the best partner to connect with us in this service. And so the way that it works for us is not only in the referral process, but we're also able to work with each other in training, right? So because we recognize the importance of, we don't know everything, and you are always learning. And I think that's something that's unique about Prince George's County, that there is so much richness in the county. There are so many wonderful resources, and we are large, but we're also a small nonprofit community. So we're able to tap from each other. We're able to connect with each other, and we're able to just say, okay, Kaniya, I have this client. I don't understand what's going on. Can you help me? Can you? And that's the beauty of it. That's how it comes about. Kaniya, take it over.
So basically everything that she says, so yes, so like even like if, like I look at it as if, for instance, like if we're out doing outreach, we may have somebody who was being human trafficked and, may got away. We don't provide those services. So like she said, we could always call to the University of Maryland SAFE Center. Sometimes we don't know, like people coming in, getting tested and things like that. We don't know their situations. So, depending on the situation, they may go see the non-medical case manager, and it may be something out of her control that the SAFE Center could handle. But I look at it as if, like, when people are tested positive, we don't know, like, how they tested positive, how they contracted it. So they also could have been where they could have been human trafficked, forced to do things out of their control as well.
Yes, you raise such a good point, both of you. And what we know from human trafficking is that our LGBTQ plus community is particularly vulnerable to predators who would seek to ensnare and to force or to, coerce in any way to bring them into what is called the life or the game. And so again, this partnership really just strengthens that opportunity to identify the most vulnerable, to identify those who may be in the midst of being trafficked or perhaps have come out of the life and need that additional support that both organizations can provide. So we are thrilled. And I realized that I failed to introduce myself, so that it makes sense why I keep saying I'm thrilled. So I am the executive director of the Human Relations Commission for Prince George's County. And in that role, we do many, many things. But one of the roles that we have been tasked with is to chair the Prince George's County Human Trafficking Task Force. And that's how all of this ties back together with Heart to Hand, our partners, and with the University of Maryland SAFE Center, our partners on the task force. And so as the task force, we are thrilled that everybody is working together, because it's only when we all start talking and working together that we're able to really capture all of the places that our survivors, our victims enter into the systems. Most may not go through the law enforcement route. Some may report to the hospital. Some may come directly to Heart to Hand or to the University of Maryland SAFE Center for a trafficking issue, but maybe not sex trafficking, maybe labor trafficking. And labor trafficking is something that a law was just passed in Maryland, took effect October 1st of 2019. And at the same time, our county council also passed a law that addressed labor trafficking, but in different ways. And so, Jatnaa, maybe you could speak a little bit about labor trafficking and the survivors that you serve in that realm.
Sure. So at the SAFE Center, we serve survivors of any age, gender, and nationality. And in that, as you mentioned, Renee, there is a wide range of survivors of labor trafficking. And we see a lot of survivors that come from different industries, but mostly hospitality industry. It can be hotels, motels, any type of hospitality industry. The food industry, it's one where we see that a lot. And believe it or not, just the salons, nail salons, spas, anything like that. And there is this misconception that everyone that is labor traffic is coming from an international country, or it's no one that is born in the United States is ever labor traffic. And that's something that is very important to dispel. It can happen to anyone. It's something that, again, we go back to the force, fraud, and coercion, right? So you can have this wonderful opportunity where you see on Facebook this job that just sounds unreal. And, you go, you answer this ad, you meet this person, you are desperate for a job because COVID-19 has created such a need right now, right? And it just sounds marvelous. You're going to get to work from home. You're a mom. You have kids that are learning at home. So it sounds great to be able to do telemarketing. But then the check does not come. You're working 60 hours and you're getting paid for 30. Then the issue becomes that you are, you're being manipulated and told that, if you do not do this, so and so is going to get hurt. If you do not do this, I know where you live. I know that you have 3 kids at home that go to this school and that this happens. I know that you're desperate. I know that I can hurt you. So and it's very important to notice that force and that fraud has to be there for someone that's over 18. And at the SAFE Center, we start off with, we have wonderful legal services where we're able to screen our clients. We're able to provide a wraparound service. If we are not able to serve you internally, whether it's something related to family law or anything like that, we're able to refer you to our low bono or pro bono attorneys. So we really always, if you have a concern, if there is anything that sounds off, we always encourage you to reach out, because it's better to reach out and be screened out than to have that question and not receive those answers.
You raised several really good questions. One, that a lot of times our survivors or even victims don't identify as victims or survivors, don't really understand that they are being trafficked for labor, as we would term it, right? Sort of the nuances. The other great point, when you mentioned the different industries that you're seeing at the University of Maryland SAFE Center, that sort of the studies really emphasize what you're saying as well. And there are a couple of other additional industries, particularly in Prince George's County, that have some concerns, and that is sort of the agricultural arena, and day labor and those sorts of things are open for abuse and this fraud, force, or coercion that we see in labor trafficking. So thank you, Jatnaa. And Kaniya, if you're like me, I hate hypothetical questions, but here goes. So I let's say that I come to Heart to Hand because I am in need of services. I just found out that I am HIV positive. Can you walk me through what can I expect? How will it look when I come there? What will happen?
Well, first we would need to see a copy of your results, and depending on how you were tested, what we do is like we do outreach, so we do the rapid test. So even if someone comes up positive for the rapid test, we still have to set up an appointment for a confirmatory test. So depending on what type of test that you've had, or we would collect information. Also, we would talk to our front desk person, and she would collect all the information. You would fill out the paperwork. They'll kind of let us know, like, if you've been in care or how long you've been out of care, just to kind of try to figure out if you're detectable or undetectable. Then after that, you would go to see the non-medical case manager. You will see the non-medical case manager. That's the person who you would talk to for any type of resources, housing, food, shelter, just so they can get a feel of your needs. Then you would go over to the medical case manager. That is the person who you would come up with a plan. You would come up with a plan, like some type of health plan or goals or things like that, like to keep you adherent to your medication and making sure that you show up at your doctor's appointments and things like that. So if we're not hearing from you, then that'll be the person who's gonna call you and stay on you and try to find out where you're at.
Excellent. So that helps to allay maybe some concerns or anxieties for someone that's watching that maybe is contemplating coming for help, who just found out. So thank you. That was good. Back to human trafficking just for a moment. I think it would be remiss of us if we left this conversation without laying down a couple of truths. One is, our victim survivors of human trafficking, whether it's labor or sex, there's not one particular type of person. Our survivors come from all walks of life, all social economic stations, all levels of education, all levels of sexual identity, all levels of religion, all forms, all languages. And so I think sometimes as humans, in order to make ourselves feel safe, we have to believe that it couldn't happen to us or anybody that we know. It always happens to someone else, to them. And so I think it's important for understanding and for making sure that the predators cannot. I have dealt with people that are so incredibly smart that still got pulled into the life on the sex side. And so it is not clear cut and easy, and it is not, it's subtle, and the manipulation, and predators are predators, right? Not even, doesn't even make English, but they are smart, and they know how to go about figuring out what it is that you have or want, and saying they will supply it. So I say that because we all must be on guard. That's the first lesson. The second thing is that our traffickers do not look like a particular way. Our traffickers look like you. They look like me. They are male. They are female. They are, again, every level. They hold a full-time job. They are the university student. They are the person in high school. Traffickers look like everyone. And so I know it makes us feel safe to believe that it's this other narrative that either social media is putting out, the vans and the, all of this, or the Pizzagate and all of that. That is not reality. The reality is that predators and survivors look like us. And so we have to understand, know the signs, be willing to learn. So that's an important lesson that I wanted to at least just lay down so that we can all be more aware. And you may be asking, where can you learn more? And I'm going to tell you that just at the very end, but we have a few minutes left, and I want to give each of our fantastic partners an opportunity to share a celebration, something great that happened, or something, something positive, instead of, sometimes we focus on the challenges. So let's celebrate something wonderful that happened. So we'll start with our partner at Heart to Hand.
Well, I think there's something that wonderful that has happened for me during the pandemic, that I was able to do an article for the United Civil Liberties Union.
The ACLU, right?
Yeah,
ACLU,
American Civil Liberties Union. Wonderful. Yeah. So I was able to do an article with them about decriminalizing sex work. So I think that kind of goes in hand with what we're talking about today. So I had a pleasure doing that, and I provided a lot of insight for them. So, and it's posted to their website. So that's something good that I've been able to do during the pandemic.
That's wonderful. Thank you for sharing. That's not a small feat. That's an enormous accomplishment. So congratulations.
Thank you.
And our University of Maryland SAFE Center, Jatnaa, what do you have to share with us?
Well, much like Kaniya, I'm going to stay on the professional route. I'm going to be very boring. But I'm very excited because, everyone has their population. Everybody has their weakness in the work that we do. We have our passion. So mine is working with youth. And the SAFE Center received the grant to be, when we were doing this pilot program with the state of Maryland called the Regional Navigator to serve youth under the age of 24 who were identified at risk or being survivors of sex trafficking. So we did the first year, and we did so wonderfully in Montgomery County that we received the second year in Montgomery County, and then also we are now the navigators for Prince George's County. And I love Prince George's County. I've lived here my whole life, and to me that's a huge success because I get to serve the county that I live in, where I work, where my kids go to school. So it's very exciting for me that we get to be the regional navigators here.
That is wonderful. And if you can, in 30 seconds, explain to our listeners what Regional Navigator means. What is that program?
Yes. So what that means is that when there is a youth identified by either Child Protective Services, law enforcement, the school system, anywhere that there may be at risk or have been confirmed, disclosed that they may be survivors of sex trafficking, once that case is reported, then we are contacted to come in within the first 24 hours, start providing services, advocacy, food, anything that the youth needs so that we can begin our wraparound services for them. We don't have any constrictions. We can start serving the youth and serve them for as long as possible, which is wonderful because, Child Protective Services serves the youth for a certain amount of time. So does law enforcement, but we don't have a limit on our time to serve that youth. So that is wonderful because we get to go from the beginning into that youth needs us.
Outstanding. That's fabulous. That's fabulous. That's great for Prince George's County. It's great for the region. So wonderful. So in closing, if you see something, say something. Please, please, please. Do not second guess yourself. Trust your instincts because your instincts are really telling you what is up. Call 911. Do not feel like you have to have an enormous amount of, that from the beginning to end. Whatever you see, give us much detail. 911. They will then learn or know how to prioritize the call or to send help or however that is done. So 911. You can always call 311. 311 is non-emergency number, and it's not 24 hours. I think the operators end around 7 p.m., I believe. I think it's 7 to 7. So, but 311 is an option if it's not an emergency. If you have other questions or concerns, you can always reach out to our agency, the Human Relations Commission, as the conduit, and we can put you in charge or in contact, I should say, with someone. And our email is on the screen. Thank you. hrcstaff@co.pg.md.us. And if you are interested in learning more, or you have a group or a civic group or work group, whatever it is, you want to learn more, please contact us. We will come out. We train free. We have been doing lots of training during COVID virtually. So the idea is that the more of us know and understand, can recognize signs, or at least have enough for the antenna, we all working together can push this horrible, horrible degradation out of our county, out of our region, out of our state, and hopefully out of our country. Not to push it into others. It's something that we don't want. So thank you. Thank you so much, Jatnaa. Thank you so much, Kaniya. If you want to leave your contact information really quickly for us, please do that at this time.
For Heart to Hand, you can find us on Instagram, H2H Inc., Facebook, Heart to Hand Inc. Our website is hearttohandinc.org, and you'll find all our services and everything that we have going on during the pandemic.
Thank you, Jatnaa.
Yes, thank you so much. So for the SAFE Center, it's just umdsafecenter.org. You can find all of our services there. You can do referrals there. You can find our contact number there. Anything that you need, you can find us there, umdsafecenter.org.
Excellent. And I forgot, we have Twitter and Instagram. It's at PGCHTTF, Prince George's County Human Trafficking Task Force. So thank you. And please tune in for we're doing 5, so please tune in for the 4 others. Thank you. Have a great day. Bye-bye.
Good one.